Coming up next, everybody, hormone replacement therapy for us guys.
Well, it's supposed to make them feel young again, but is there any downside or risk to it? Well, ladies, do you ever feel like your man isn't as interested in you as he used to be? Well, it may have nothing to do with his level of attraction to you or even your relationship. It could be his hormone levels. At issue, testosterone, the hormone responsible for transforming boys into men. Numerous studies have shown testosterone levels start to decline in men starting in their late 30s. Testosterone replacement therapy is one option for men who are bothered by those changes. Now, some men claim it restores strength and libido. Some doctors worry about the risks. And joining me right now to talk more about hormone replacement therapy for men is Dr. Karron Power. And doctor, we thank you so much for being here today.
Thank you.
We all know about women and hormone replacement therapy. There's been some controversy about that, obviously, for women. Let's talk about it for men. How effective is it? And how many men are using it really at this point?
It's become very popular now. I'm sure everyone's seen the commercials on TV for androgel, using the gel form of testosterone replacement. And of course, as the population gets a bit older, then low testosterone has become more prevalent.
We're going to look at some of the symptoms if you think you actually need it. We're going to look at right there on screen. You can see them: reduced libido, decreased strength or endurance, falling asleep at dinner, or even poor performance at work.
Yeah, I have a lot of men in my practice. We call them executive athletes. They really need that extra edge in the workplace.
And you brought some with you here today.
Did.
How are they applied?
Well, there are many different ways to use testosterone. There are testosterone creams, and this delivery mechanism has made testosterone more popular, I believe, because it's so easy to use. Traditionally, we've used testosterone in an injectable form, and there are also the testosterone that you can apply underneath the tongue, and it dissolves directly into the bloodstream.
All right. Now, you can't really discuss this issue without talking about some of the ramifications of it. There was one doctor who was quoted in some of the research where I read, he said, if you don't have to do it, don't. Concern about lowering your sperm count, acne, other side effects of using hormone replacement. Your thoughts on that?
Well, absolutely. This is medical treatment, so there can be side effects. Some can be controlled, but there are risks as well. I'm always concerned about treating a man who I think might have active prostate issues, specifically prostate cancer, as it could accelerate the growth. Also, uncontrolled hypertension, which isn't here on this list, but that can become more difficult to control once testosterone is started. And in a man who's actively trying to plan a family, then the sperm count can be lowered by testosterone replacement.
Which sounds odd on the face of it when you hear it, but of course many men are having children much later in life. So it actually could become an issue if you start doing this, say, in your 50s and you're starting a second family.
Right, and we're also seeing men in their 30s and 40s with low testosterone, so it's often an issue in those men.
Let's talk about the women and how they relate to this. Women are kind of the Velcro of the universe.
Yes. We
have a tendency to look at ourselves and we think something's amiss in the family. What do you tell the women who have partners who are going through this?
This tends to come on very gradually. The testosterone lowers in a man very gradually. It's not abrupt. And some of the symptoms sound like normal aging, just increase in fatigue and lower libido, and men lose some of their strength, and they really lose interest in life. They don't want to go and go out on the weekends or be as active. And women often think that men are bored or depressed, and of course they think it's due to something that they're doing. And libido is an obvious marker of a relationship and a man's interest.
Dr. Power, to give people at home an idea of how much this costs.
Well, it really varies, but most men are going to spend $2,000 a year when it comes to all their medications, lab work. They really want to be followed carefully because there can be risks. This is powerful medicine.
All right, and is it all out of pocket or some covered on insurance?
Some can be covered under insurance.
All right, Dr. Power, we thank you so much for your thoughts here today. Dr. Power from the Youth Renewal Center, and I'm going to kick it over now to Jeff.